Well, the holidays are right around the corner, and many kids will have a cell phone on their wish list. But parents, should you buy it? If they are under 12, you may want to look at a new study published in the journal Pediatrics. Researchers looking at data from over 10,000 children and found the younger a child is when they receive a smartphone, particularly under age 12, the greater risk of them developing mental and physical health issues, things like depression, anxiety, poor sleep, obesity. Now, the study only shows the association between age and cell phone, not the cause and effect. However, prior studies have pointed to effects such as spending less time socializing in person, as well as less time spent on exercise and sleeping. Dr. Sheryl Ziegler is a clinical psychologist and author of The Crucial Years and joins me live. Dr. Ziegler, great to see you. First, are you at all surprised about what this study is showing?
I'm not at all surprised. We really have had this data that's been accumulating over the last couple of years. So we had the Surgeon General in 2023 talk about this. We had a recent study come out earlier. I think that what's unique and special about this study is the size. This was a large study, over 10,000 children. We had some really major universities involved. And I think that the data show the results were clear. When a kid gets a smartphone, and I have been asked this question, so I want to say it now, people will say, well, what about an iPad or a tablet? This actually seemed to be pretty specific to a smartphone. So I actually want to highlight that. When a kid gets a smartphone earlier than the age of 12, we see these detrimental outcomes. Like you said, increased mental health issues, particularly depression, increased incidences in obesity, and what we call disturbed sleep, meaning they're not going to sleep either early enough or they're not being able to sleep throughout the night, typically because they are dysregulated or answering kind of texts or other things that are going on the smartphone. So this is just another really great study that shows us what parents really need to do.
Absolutely. I mean, these algorithms just get better and better because I find myself just mindlessly scrolling where I'm, and I have to put it down. So on the flip side of this, though, Dr. Ziegler, some critics say correlation does not imply causation, or that it's possibly not the phones, but the habits of the family. How would you respond to those criticisms?
Yeah, I think it's fair. We're talking about research, and so we do want to be clear about what we're saying. I think that right now, what we meaning the fields of psychology, child studies, the medical world, what we're really saying is the research is getting really clear about what specifically happens when a child gets a smartphone at younger ages. So things like sleep, very tied into physical and mental health. So if you want to preserve your child's sleep, you may want to think about not doing this. Things like depression. Well, yes, you can argue, what are they doing on there? Is this really, what if they're not on social media? What if they're just playing games? There's a lot of what if questions. And I think one of the things that was very promising about the study is that one of the lead researchers said, we have subsequent studies that are going to follow. We're going to start asking those questions. We're going to start getting into it more. So I think parents need to be patient in terms of exactly what are we saying and what aren't we. But I do want to be clear that what we're saying now is not the very first study to say this. It's a big study to say it. And it's really consistent with what we've been seeing for about the last 5 years, which is smartphone use and social media use, which are two different things. Both of those things, the longer we can wait, generally, the better the physical and mental health outcomes of children are.
Absolutely. And I'm glad you did specify, social media is different from just having a smartphone. But based on what we continue to learn, based on, what these studies show us, so many parents, I think, are confused. What is the right age to get your child a smartphone?
I think it's a great question, and I know there's a lot of caveats. The first thing I want to say is the biggest excuse that I see, not excuse or reason that I see in my private practice is parents will say, it is a safety thing. I need to be in touch with them. They're out and about, or maybe they have two homes, and we really need to communicate with our kids. Fair. There are other devices that people can purchase in order to communicate with their children, right? So look at a smartwatch. That's a great place to start. And again, You can also say many kids already have an iPad. An iPad is essentially a very large phone. It is used differently and it seems to have different outcomes, but your child can have other ways of communicating. Those are by and large, the absolute top two reasons why people say they need to have it. So I think the first thing to do is look at some of the alternatives. Also, in my book, The Crucial Years, I have an entire chapter on this because it's focused on 6 to 12-year-olds. And so I really provide that guidance around before your kid is on a device of any sort, you need to know how to use it. You need to monitor it. You need to know what the safety risks are, and you need to have a contract and really boundaries around it, because we know that it's something that's really leading to poor mental health outcomes in kids in a way that really requires parents to respond.
And last question for you, and you brought this up in your first answer. Do you think some of this applies to tablets, to iPads? Because we know many parents are exposing their young children, to tablets at very early ages.
I think that the detrimental outcomes of tablets at very young ages, so now I'll qualify that as maybe 10 and under, what those outcomes are slightly different. I think that probably has more to do with cognitive functioning, meaning attention span and social skills and even language skills. I think when we're looking at about 10 to 12 and older, what we're looking at are more of the mental health and sleep outcomes. So they both have detrimental outcomes. Why? Because children's brains are developing. They really need social, in real life interactions with human beings, not being on devices, again, longer than 30 to 60 minutes, which happens when you have the device in your hand. So I do think there is a difference.
All right, Dr. Sheryl Ziegler, thank you so much.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.